Current health now. Tropical diseases are prevalent in or unique to tropical and subtropical regions. They are infectious and affect billions of people around the world. Now, recently, experts and advocates gathered at the 66th annual meeting of the American Society for Tropical Diseases and Hygiene. Africa 54 health correspondent Linord Moudou has this report.
In 2015, malaria infected about 212 million people globally. An estimated 429,000 people died. The World Health Organization says dengue fever infects 50 to 100 million people each year. These mosquito-borne diseases thrive in the hot and humid conditions of the tropics, bringing sickness, death, and despair. This kind of tropical diseases affect more than 1 billion people worldwide. Doctors and scientists discussed progress in global efforts to find new and improved solutions. Dr. Mamadou Barre is from Mali.
This is one of the biggest meetings for tropical disease in the world. So this is an opportunity for us to show what we are doing and to meet other researchers and to have a new partnership and collaboration with other institutions.
About 4,400 participants from 100 countries attended the conference in Baltimore. The main objective was to find new tools and strategies that will reduce the worldwide burden of tropical infectious diseases. There were presentations of cutting-edge research, ongoing health threats, and latest tools for addressing diseases and outbreaks. Dr. Patricia Walker is president of the American Society of Tropical Medicine and Hygiene.
Parasites are always evolving, so we need to not rest on what we have learned in the past as scientists, that we need to develop new tests, new treatments for diseases, and so we're constantly needing to stay ahead of the tropical diseases that are evolving so quickly.
Dr. Walker says funding is crucial. Tropical diseases cost developing economies several billions of dollars each year. Malaria alone is estimated to cost Africa $12 billion every year. That includes cost of healthcare, absenteeism, and loss of investment in tourism. About 80% of the global burden of malaria is in sub-Saharan Africa. Children under 5 suffer the most, so do pregnant women. Kate Wolf is malaria team leader for the U.S. Agency for International Development's flagship maternal and child survival program.
So what we do is we help people get access to services. For example, in Kenya, we're using community health volunteers to help women access prenatal care. And last year, we were able to improve the number of women who come early for services by 50%, which means more women are getting access to life-saving malaria medicines earlier. Last year, JAPICO was instrumental in delivering malaria medicines to 1.3 million pregnant women globally.
Eva Nathanson is with UNITAID.
We have investments in new ways to prevent malaria amongst children. We are working with Malaria Consortium to prevent malaria amongst pregnant women. We are working with JAPICO. We are also working with an organization called IVCC to get better insecticides out in countries to spray houses to prevent malaria. And we are also working with a number of other partners here that are present here in Baltimore this week to curb malaria in countries where the needs are the greatest.
Not all tropical diseases are transmitted by mosquitoes. Dracunculiasis, or guinea worm disease, is contracted when people consume water from stagnant sources contaminated with guinea worm larvae. Considered a neglected tropical disease, it incapacitates people for extended periods of time. Whether they are neglected, such as guinea worm, or receive more attention like malaria, medical experts hope to make the high burden of all tropical diseases a thing of the past. Linord Moudou, VOA News, Washington.